As the governor mentioned, these increases have significantly changed the look of our color-coded map. We've reached out to all 9 counties in red this week to discuss the cause of these increases. In some instances, increased outbreaks are related to congregate settings, and this is driving the change. But the majority of the increase is a result of community spread and pandemic fatigue. We're hearing that people are refusing to wear masks, that some employees are being told to come to work even when they're supposed to be on quarantine, and that parents won't test their children for fear of having to quarantine. I understand that this is hard. This entire year has been hard, but it's going to get even harder if we don't recommit to those very basic mitigation procedures that we've been discussing all year. Wearing a mask, socially distancing, staying home if you're sick and getting tested, and washing your hands. Based on information we're hearing on national calls, we expect the surge that we are currently experiencing to continue for a number of weeks. But actually how long it continues depends on the actions that each of us takes today and in the coming days and weeks. That's why we are implementing the following requirements in counties that are in orange or red. If your county is in orange, social gatherings of any kind, indoors or outdoors, are limited to 50 people. Indoor special events, seasonal or commercial events for which more than 50 people are requested to attend must submit a plan to the local health department and receive approval before proceeding. Capacity in common areas and break rooms should be reduced, and users should always be socially distanced. Attendance at winter indoor K-12 extracurricular and co-curricular activities, including IHSAA sports, is limited to 25% capacity in consultation with local health departments. All non-competing and non-performing participants, support personnel, and attendees are required to wear their face mask and coverings at all time. All non-family groups must be socially distanced. IHSAA football games on Friday, November 20th may continue utilizing IHSAA guidelines that require local health departments and communities to determine the stadium capacity. The IHSAA will work with the Marion County Health Department on a limited spectator plan for state championship games at the Lucas Oil Stadium. Community recreational sports leagues and tournaments may continue with attendance limited only to participants, the required personnel, and a parent or guardian only. If your county is in red, social gatherings of any kind, indoors or outdoors, are limited to 25 people. Indoor special events, seasonal or commercial events, are not advised to be held, but a special seasonal or commercial event for which more than 25 people are requested to be in attendance must submit a plan to the local health department and receive approval before proceeding. College and professional sports events are included. Vulnerable populations should remain isolated. Social and holiday gathering participation is not advised. All business capacity must adhere to strict social distancing guidelines, and curbside pickup is preferred. Local officials may consider limiting hours for the operation of bars, nightclubs, and restaurants. Attendance at winter sports, indoor K-12 extracurricular and co-curricular activities, including IHSAA sports, is limited to participants, support personnel, and a parent or parents and guardian. All non-competing and non-performing participants, support personnel, and attendees are required to wear face coverings at all times. IHSAA football games on Friday, November the 20th may continue with attendance limited to the participants, support personnel, and parents or guardians. The IHSAA will work with the Marion County Health Department on a limited spectator plan for the state championship games. Community recreational sports leagues and tournaments may continue with participants, required personnel, and parent or guardians only. Senior center activities are suspended. Hospitals, long-term care, and other congregate settings may impose visitation limits. Common areas and break rooms should be closed.